after the unfortunate incident at Walmart. And please know that it means so much for you personally to do that, to our staff, and I want to publicly thank you for that. I also want to thank Governor Whitmer for support of rural health care. She's been an advocate for us for many years, and we really appreciate that support so much, especially in these turbulent times with changes in our healthcare funding and what that puts at risk for the insurance coverage of our most vulnerable citizens. And as we think forward, we serve 500,000 people here in northern Michigan, and they are dependent on having insurance coverage for their health, for the health of their local community hospital. And so your tireless efforts to ensure that access means so much to our communities. And to talk a little bit more about the impact of insurance coverage to our most vulnerable, I want to have Dr. Joe Santangelo, a physician or chief medical officer, talk a little bit more about what that means. Joe?
Thanks, Ed, and thanks, Governor. As you can tell by my title is I'm the Chief Medical Quality and Safety Officer, but before all of that, I'm a pediatrician. And as a pediatrician, I practiced for about 20 years. And the hallmark of pediatric care, and adult care too, is preventing illness rather than treating it. If we can prevent illness, we would much rather do that than treat it once you get it. And having insurance, accessibility of affordable insurance, whether that's through the marketplace, Medicare, Medicaid, or private insurance, is incredibly important to being able to access preventative care. Research tells us that people are about 60% more likely to get preventative health care if they have insurance coverage. And so when you think about heart attacks, or stroke, or type 2 diabetes, many of those cases are preventable if you get the right care before you get sick. And so it's easy to see just how important this is to our communities. And this is especially true here in Northwest Michigan, where we have such a high proportion of people over 65. So keeping people healthy, reducing the strain on our hospitals and on our other healthcare resources, like our long-term care facilities, skilled nursing facilities, is really important. And anyone who's had a significant medical condition yourself, or has had a family member with a significant medical condition, knows just what a stress this is, and we don't want to add worrying about insurance coverage to that stress when you're dealing with a medical issue. And there's few people who deal with this more closely and who are more aware than this than our case management team. And so I'd like to hand off to Director Anita Fox, who's going to talk a little bit more about that. Thanks.
Good afternoon. I'm Anita Fox. Thank you, Dr. Santangelo. Thank you, Munson, for hosting today. I'm the Director of the Department of Insurance and Financial Services for the state. I have honor of serving with Governor Whitmer and focusing on this important issue that we're talking about here today. I want to thank you, Governor Whitmer, for your leadership and ongoing commitment to protecting Michiganders and their health insurance options. It's never been more important than it is right now. By working in a bipartisan manner, last year we expanded access to health insurance and codified protections from the Affordable Care Act in Michigan law so that we weren't at the whim of what might change at the federal level. And as a result, Michigan currently has the lowest uninsured rate that we've had and one of the lowest in the country, around 5.4%, meaning that 95% of our folks have some kind of insurance coverage, and you've heard how important that is in terms of maintaining healthy Michigan. That means that more Michiganders have health insurance that they need, not just when they're sick or hurt, but to have them stay healthy and to avoid big medical bills and the stress that puts on families. Everyone should have access to affordable, high-quality insurance coverage that they can count on when they need it most. During the last open enrollment season, more than 530,000 Michiganders enrolled in health insurance through the marketplace. And even more important, perhaps, nearly 90% of them were able to enroll in a reduced cost health insurance plan that worked for them and their families through tax credits and to lower their premiums, and some of them for $0. Under the Biden administration, those tax credits, and we call them the enhanced tax credits, were extended and expanded in 2021, which meant that more families qualified and families saw bigger savings, leading to this low uninsured rate. Now the expanded tax credits are about to expire at the end of 2025 unless Congress takes action. If they don't, which, reading the news, we understand the realities of what's happening at the federal level to programs like that are so important to our communities. The impact on Michigan family will see that thousands of families will see an increase of $400 per month more a month. An overall average cost increase by 75%. And that means, as you can imagine, that many Michiganders may risk going without health insurance because they can't afford it. And that not only impacts those families, but it increases costs for everybody. In addition to the expiration of the tax credits, the federal government has made sweeping changes to health insurance for consumers. Michiganders will face additional verification requirements and restrictions that will make it more difficult to stay enrolled and become enrolled in health insurance. Michiganders could lose access to doctor visits, hospital stays, prenatal care, prescription drugs, and mental health care that they need, and they need it now. Next year, there will also be less time to enroll in insurance during the open enrollment period, meaning consumers will have less time to review their choices and make a selection. The bottom line is that due to federal changes, all Michiganders currently enrolled through healthcare.gov, the marketplace, will pay higher prices for their current coverage, and many will risk losing coverage altogether. With so much at stake, we need to be proactive. Michiganders need to be proactive, and that's why our governor has been proactive on this issue, not waiting for the changes to take effect, but stepping in and talking to anybody who will listen about how we can protect more Michiganders. It's also a great time for people to take a look at their own health plan. There are going to be changes. If you haven't done your preventative care, or you know people who haven't, or have benefits that don't count on them being there the same way they were before, take advantage of those benefits now and let everyone know that these changes are coming and we need to be proactive. I also encourage everyone, even if you've had the same health plan for a long time, take a look during open enrollment. Things have changed. Make sure you're doing the best plan for you and your family. And with all these changes, it's so important that we do what we can to keep Michiganders informed and prepared for what's coming in open enrollment. And DIFS is on board to answer the governor's call to educate Michiganders on the upcoming changes to open enrollment and ensuring that all Michiganders can find and maintain health insurance coverage. This is all a hands on deck at the governor's direction for our department, and we want to make sure that we're there for you. Michiganders who need help understanding their health insurance options can call us. We have a live call center Monday through Friday, 8 to 5 at 877-999-6442. You don't have to memorize that. It's on our website. You can look to michigan.gov/health insurance. Direct everyone you know to there. We always like to say there's no wrong door. If you need to get somebody directed through to Medicaid or through the federal programs, start there and we will help you find what you need to get the information. So thank you, Governor Whitmer, for having me here today and for continuing to work to ensure that all Michiganders have access to quality, affordable health insurance. I'd like to turn the podium over now to Nurse Liz Monk. Good chance to thank a nurse for all that you do. The Director of Case Management and Patient Safety from Monk.
Thank you. Good afternoon. I'm Liz Monk. I'm the System Director of Case Management for Munson Healthcare. My team and I work directly with the patients every day, and I want to represent the very unique challenges that our patients face today. Access to insurance is important to our rural healthcare populations because it saves lives. One example I want to share is of a case that we had prior to the implementation of the Affordable Care Act. We had a patient present to our ER with pain. The scans showed an aggressive end-stage cancer. Now the patient didn't have insurance. In order to get the patient on insurance, we had to first get a definitive diagnosis, then they had to enroll for disability, and then after that they would receive their insurance so they could get treated for the cancer. The patient was navigated by our free clinic to a surgeon who did pro bono surgery to get the biopsy. That gave us the definitive diagnosis. Then the patient was able to enroll in disability. Once they got their disability, the patient got an insurance and was able to pursue cancer treatment. Unfortunately, that took 40 days, and the patient's cancer progressed to such that they needed hospitalization. That was their final episode of care. The patient passed before they were ever able to get to a single oncology treatment. Fast forward a couple years after the ACA has been implemented, we had almost an identical case show up to the ER. The same type of cancer showed up on scans, and the patient didn't have insurance. Because we were able to get them quickly on insurance, we were able to get the diagnosis and get them to cancer treatment within 2 days. Now, it's not always that easy or that simple today. We continue to face challenges with the current state of enrollment and eligibility periods. All of these types of administrative barriers to getting the patients the services that they need are going to be compounded with impending changes introduced in the HR 1. Now imagine your future. You're on Medicaid. You're having to re-enroll every 6 months, prove your work requirement. All of a sudden you have a significant health condition and you wind up in the hospital. Your recovery period is such that you can't work during that time. You're not able to work and prove the work requirements to maintain your insurance. You're not to the point where you qualify for disability. Now you're not only facing a new health condition that you have to learn how to manage, but without insurance. We are grateful to the governor for being proactive to negate some of these negative impacts that we expect to see in our rural health care system. Thank you.
Thanks.
Now, let me introduce Gretchen Whitmer, our governor.
Thank you.
Thanks.
Thank you, Liz. Well, thanks. Thank you. Well, first, let me just say, I don't know that many people have articulated the challenges, as well as Liz just did, from the patient's perspective in terms of what hurdles have been erected between people and their care. So thank you, Liz. I want to thank Munson, not just for hosting us, not just for always speaking out so that people don't lose sight of what policies in Lansing or Washington, D.C. mean to rural hospital systems, but also for showing us the absolute best in care, just with the incident last week. I had the opportunity to meet with some of the folks that cared for the injured, and it was a master class in how to respond in a crisis, and something that the system is obviously very proud of, but all Michiganders are too and grateful for. So today I am going to be signing an executive directive to support access for affordable, high-quality health care for our friends, families, and neighbors. I want to acknowledge Director Fox, who is the head of DIFS. She's always looking to see what can we do to make Michiganders' lives better. Where is there a problem coming down from another part of the country that we are going to be impacted by that we can try to solve for? And so this, I think, is one of many steps that we are trying to take to mitigate the pain that I think is going to be inflicted on healthcare, on patients, on people all across the country. Right now, more than 23 million Americans rely on insurance that they get through the Affordable Care Act. That includes over 500,000 people in our state who get good coverage without breaking the bank. Working families who have been able to take care of the ACA's enhanced premium tax credits lower their health insurance costs by 44%. On average, that's more than $700 saved every single year. And it could be more depending on your income. Working families rely on these extra dollars to afford the basics like groceries or utilities or rent. So put simply, the ACA provides a lifeline to so many families who are just trying to get by. We know that with the big bill in Washington, it's taken a wrecking ball to the affordable health care in this country. They've jammed through, in Washington, D.C., Republicans jammed through a bill that forces Michiganders to jump through more hoops to verify their income when they renew or sign up for insurance, as Liz just explained. Altogether, their policies could increase out-of-pocket premiums by more than 75% and force over 4 million people off of their insurance nationwide. And of course, that's devastating for those 4 million, but it has an impact on every single one of us who depends on these health systems to be there when we need them. For thousands of families across Michigan, it also will mean $400 more a month simply to keep the health insurance that they have. $400 a month. Very few families can absorb that, and certainly none who are qualified right now can. So this will make it harder to get or keep health insurance. It'll also hurt the people who need it the most, including entrepreneurs or small business owners, young families, folks with one or more hourly jobs. These are people we know, our family and our friends and our neighbors of all ages. And so that's why today I'm taking action to support access to affordable health care for Michigan families. The executive directive that I am about to sign will order the Michigan Department of Insurance and Financial Services, not that Anita needs to be ordered, she's already said they're already on the case, but we wanted to make this formalized because it's crucial that we maximize our ACA enrollment. It's crucial that people across Michigan know that they've got tools and the ability to get their answers, to get answers to their questions. I'm going to be asking DIFS to connect Michiganders with more affordable insurance options and answer any questions that they have about the process. I can't unilaterally reverse what's happened in Washington, D.C., including all the votes that so many of our own congressional delegation cast. But what I can do is whatever it takes to help make life a little easier for Michiganders and the work that we can do in state government to ensure that people have a little help when they're facing these challenges. No Michigander should have to choose between paying their bills or getting to the doctor or buying groceries. A few weeks ago, I was proud to relieve $144 million of medical debt for nearly 210,000 Michiganders. Because you're sick or get hurt shouldn't mean going broke. And we were able to get that done. This is one more step, as well as assessing all the impacts of the bill so that people know what is coming and so that we can take actions that is right for us and our families. So let's take that next step and get this executive directive signed. Thank you all for being here, and thanks for the work that you do.
And this is the extraordinary team I was talking about, who was on call last week and helped so many people.
Awesome, we'll get Julia right over there. Also great, I love our Munson's team, who's helped out, come up here as well, please. Alright. You guys can kind of move in too as well. Okay, I'm a spotter. Just kind of make a window. You can, oh, you're from like that. Okay, great. Awesome. Thanks, everyone.
Okay?
How's it going,
Hey,
man?
thanks for coming out.
Yeah, thanks for having me. I appreciate it.